So I'd like to hand over now to Dr. Richard, and he's going to tell you a little bit about himself, and we'll get started.
Thanks, Jim. Really appreciate this opportunity. Really excited to be here. As she mentioned, I'm a pediatric dentist. I'm a board-certified pediatric dentist practicing in Alabama, Tuscaloosa, Alabama. I also have an extensive interest in public health and have been involved in a lot of different aspects of advocacy and increasing access to care and medical dental collaborations and that sort of thing. So I currently serve on the advisory board for both Holland Healthcare and the Teledentistry.
Fantastic. So Dr. Richard's now going to talk to us a little bit about teledentistry and why it's important and the benefits. So I will hand back over to you, Dr. Richard.
Thanks, Jen. So just, we have a varied group of people attending this. I know we have a lot of dental professionals, but there are some other lay people, persons and possibly other healthcare providers. So just kind of want to give a basic summary at first. Teledentistry in a strict definition sense is the dental form of telehealth services. And like telemedicine, teledentistry utilizes telecommunications, imaging, and other technologies remotely and virtually connect patients and care providers, or even providers directly to providers, to address oral health issues, really in a more efficient and convenient manner. It enables the dentist or other healthcare providers to provide some key essential dental services beyond the confines of the traditional brick and mortar office or clinic. A couple of terms that some people may or may not be familiar with in regards to teledentistry as well is there's really two forms. There's synchronous, which most commonly is called real time. For instance, video as things are occurring, so that images are being sent by video to the dentist or other care provider, and they're doing real-time evaluation. The other and more commonly used in teledentistry is asynchronous. So clinical information about patient is collected as well as images and transmitted for review, sometimes called store and forward. This could be either a patient or a parent of a patient sending an image directly to a dentist, or it could be another dentist or other healthcare provider taking that information about the patient and the images and transmitting it to another dentist for consultation or collaboration within a group, or even possibly for referral.
Fantastic. So also we wanted to talk to you a little bit about today's climate and why, teledentistry is important given the current pandemic and COVID. How have you sort of been using teledentistry?
Sure. Well, just to back up just a little bit, obviously in teledentistry, we're not talking about providing tooth extractions or doing a filling, but so much of what we do in healthcare in general, and that also applies to dentistry, initially particularly when it's problem focused, is we're obtaining a history. We're doing an initial clinical exam, an assessment. We're developing a working diagnosis. We're triaging the degree of urgency, if there is any urgent needs there or not, and we're determining a disposition. So, does the patient require care? When does that need to be done? Is it fairly routine? And do they need to be scheduled? Do they need to be referred? Do they need to be seen urgently? So, in most cases, this initial type of care and assessment can be done remotely through teledentistry. And that the most common version of this is problem focused patient to dentist. And with the development of the pandemic last year, and as that came about, I know throughout the country, in the U.S., dental offices were shut down. Here in Alabama, we were closed for 7 weeks. So even though teledentistry was starting to come along on board, this really dramatically accelerated the implementation of teledentistry into care. And in a lot of cases, third-party payers working with Alabama or the American Dental Association, Medicaid, and other payers came on board realizing that there were significant advantages in utilizing teledentistry to reduce risk and exposure, to reduce the need for people to leave their home and come into a facility, even when the facilities opened up. But very importantly, during that lengthy period, I know some states it was as long as 2 or 3 months where they were closed.
Mm-hmm.
It was vital to provide essential assessment services, triage, and so in scenarios like in our office, quite often we probably saw 2 or 3 teledentistry patients a day through imaging, through phone, variety of other manners,
Mm-hmm.
where we could, and being pediatric is most of the time the parent contacting us, but decide to see what's going on, what the complaint is. Quite often it was very simple things like we have a loose tooth, we have an erupting tooth. But if it was something that was potentially a dental abscess,
Mm-hmm.
some other need, we could provide guidance on palliative care at home. We could phone in a prescription for antibiotics if necessary. We could get advice on over-the-counter pain medications and make a determination whether it met the standard for being significantly urgent and whether they needed care. And then in those cases, we were authorized to go in and provide that care. But quite often we were able to get them comfortable. And then once we opened up, they became priority first for contacting them to get them in for care. So it worked very, very well for us in COVID-19, and even now,
Mm-hmm.
there's still a need and a desire to try to reduce exposure, try to reduce risk. If patients don't have to come in, if we can do an initial exam or evaluation through teledentistry and then determine what those treatment needs are likely to be, then we can schedule them appropriately for that, as opposed to having them possibly come twice and sometimes travel quite a distance so that we'd have to do an exam the first time and then get them back for treatment. So we're really saving a lot of difficulty for the parents, making things more efficient for their care, and providing an opportunity to reduce like I said, risk during this time.
Do you think this also gives rise for that peer-to-peer sort of connection as well, where it might be, maybe an example of a physician seeing something that they want to connect a patient through to a dentist? Are you seeing that as kind of that teledentistry side as well?
Yeah, there's so much on the horizon of where teledentistry can go in healthcare.
Mm,
And so the scenario that I gave you is the most common scenario for teledentistry, and that's the patient to practitioner or provider in a problem focused manner. But absolutely, there's other realms that this can be used. Very commonly, dental to dental.
mm,
So you have a dentist that needs a consult with a specialist, whether it's an oral surgeon or a general dentist needs a consult with a pediatric dentist, particularly when you have more rural type dentists in smaller towns and they don't have a specialist in the area. Being able to utilize teledentistry to do an initial assessment and determine, again, degree of urgency, decide what needs to be done, possibly do a
mm,
consult, and then a referral appropriately can make a big difference. But
mm,
when we look at the medical dental relationships, that really, as we are learning more and more about the importance of oral health to our overall health and medical dental collaborations in whole patient care and comprehensive patient care, it just lends itself to many opportunities. Whether it's physician offices in urgent care centers and family practice and pediatrics, whether they have a patient with a complaint or they have something that's a concern that they're seeing, being able to consult with a dentist who has agreed to do teledentistry with them and do an assessment initially asynchronously or synchronously with the office. Then they can, quite often, like with pediatrics, we can say, oh, hey, this looks kind of kind of weird or kind of hinky
Yes.
is not a scientific term, but
Mhm.
this is actually fine. This is normal anatomy, or this is this is something that the parent doesn't need to worry about. But we do recommend that we get a follow up for what you're showing me now with this problem.
Mhm.
So yes, there's a lot between the medical and dental side, and as you mentioned, really peer to peer and really kind of helping, I think, even grow practices and grow relationships,
Absolutely.
working with your medical colleagues. But there's I'll stop there for a second. But there's a lot of
Yeah.
other scenarios that I think teledentistry could be looked at.
Absolutely. And that leads me into, talk about why we need solutions to help actually, on the teledentistry side. I am a mother of four, so I actually have four children, and over the course of the pandemic, I think they've lost that many teeth that I've actually lost count. And back in 2017, I started on the journey of TelScope to actually create something where someone could, a patient at home could connect an oral health concern. And that's where it started. And then last year happened, and teledentistry just got, it was accelerated by the pandemic. So I'm very, happy to be the patient and actually be able now to connect my oral health concern from the safety of my own home. And if it is something that I need help with, being able to then come to you, Dr. Richard, and be seen, I think is so important. So I actually have my daughter here with me today. So Dr. Richard and I were going to tell you a little bit about TelScope and also go into a live demonstration on how it works. So first of all, I'd like to just let you know a little bit about it. So TelScope is an intraoral telehealth system. It's used by medical, dental professionals and also their patients. So TelScope combines intraoral illumination with your own smart device to provide superior intraoral telehealth images anywhere, anytime. So now that I've mentioned this, I know Dr. Richard is also an advisor of our company and he's been working with us. He does use TelScope, and I'm going to cross over to Dr. Richard and see if he'd like to tell you a little bit more about how he uses it. And over to you, Richard.
Yeah, great. Yeah, actually, one of the things I'm using it for right now is just building a teaching library of photographs of different different problems that are coming in that we're identifying, even normal anatomy and that sort of thing. Because I really think there's a lot of opportunities for training ancillary staff as well as other dentists on how this can be utilized. And really, when we're talking about, if you don't mind me touching on a couple of things where I think things like TelScope can be so helpful.
Absolutely.
In teledentistry, when we're considering access to care issues, declining workforce in rural communities, the large percentage of population, at least in the United States, that hasn't seen a dentist within the last 12 to 24 months, underserved and difficult to serve populations like elder care, special needs patients, having the ability inexpensively to capture images, transmit those images, and have those evaluated by a dentist remotely really dramatically improves the ability to provide essential initial oral health care services, and allow for consultation, and then decide if there needs to be a referral with a dentist, and further follow-up care. I know my mother was in bed for 2 years straight in a nursing home, and she was lucky enough when she had three different dental problems to have a dentist son come visit her and take care of the issue. But
Mm,
otherwise, she would have had to have been put in an ambulance and transported to a dentist for things that honestly we were able to take care of there in the nursing facility. So when you think about the ability to use something like TelScope in nursing homes with care providers there
mm,
that can say, hey, we got a complaint of a sore spot or swelling, and then that can be transmitted to the dentist, or you can have in a lot of places, hygienists can go out without being under through direct supervision and
Mm.
provide screenings, provide assessments, capture images, send those back. Even just in the educational realm, and there's a real issue with enough patients coming into dental schools. And so there's a big outreach into the communities of taking dental students out to the communities, patients. Well, if you have this ability to capture images as these are being done, then those can be transmitted back for further evaluation later on. And you also have the ability potentially for medical and dental offices in remote areas to send images when they have areas of concern for possible oral cancer and have those
Mm.
evaluated by specialists and go, that's something that needs to be seen pretty soon. Let's go ahead and make an appointment for that. Or no, hey, that looks like such and such. Keep an eye on it. Reevaluate it in a few weeks. So there's all of these potentials there that doesn't require an expensive dental camera, intraoral camera, and a lot of medical facilities are not going to have that. And so whether the telescope is with patients or with parents or with healthcare facilities, even in hospitals, we spent over $2 billion last
Mm.
year with patients showing up in emergency rooms for dental problems, over
Yes.
2 million visits. And so if those could initially be assessed there, images could be taken with the telescope. And I know telescope now is linked with the teledentist. And so that could immediately provide a dental consult live with a dentist within less than 10 minutes. And then an assessment and a determination of whether there's antibiotics or other type of care needed to be provided, and then provide for a referral after that. So I know that opened up a lot of discussion there, but I just see so much potential in providing inexpensive, accessible quality imagery into areas outside of the brick and mortar dental office.
Yeah, absolutely. And I think that's what it's about, isn't it? It's being able to get care to people, when they need it most, and connecting them straight away, not having that wait time between it as well. I know for myself with my children, when I'm at home and I have an issue, it still takes me at least a couple of days to get in to see my dentist. So to help set my mind at ease, just to be able to send an image through to a teledentist, for whether it is used to triage my child or whether it's used to just give me that peace of mind that she's okay or he's okay, I think is really important from a patient point of view. So, yeah, look, I'd love to do a demonstration with you, Richard. So I'm going to get my daughter, Victoria, and she's going to help us today with this. This is Victoria.
Hey, Victoria, how are you?
Good. So, yeah, basically, TelScope is a disposable blade and a reusable handle. Sorry, I'll just come into the screen. And you simply attach it together. Um, and then Dr. Richard, can we see in the
Yeah,
screen?
I found that the telescope, the light really provides such a
Can you
tremendous
come a bit
benefit in being
closer,
able
Tom?
to
That's
see
it.
very clearly throughout the mouth, as opposed to trying to use room light. And it easily depresses the tongue. You can use it to move side to side. Quite often, we're wanting to see where we can retract the cheek out of the way, see along the sides of the teeth, and then very easily get the patient tipping it back or leaning forward. And then if necessary, you can take a finger and move the lip up out of the way, or down out of the way, or the cheek out of the way if a little bit more needs to be seen. And a lot of times I'll use the telescope like that. First, just with the throat scope, and then connect it
It's
to the
really hard
phone
for me to.
when I see what it is I want to take a picture of.
Yeah, so basically it's just a little metal clip on a phone case, and then you just slide the TelScope device up onto it. Once it's attached, it becomes a digital health tool. It's very simple to use. And then you can just click on the TelScope app and it brings it up like this. And then we'll be able to see a little bit better inside Victoria's mouth here. So there it is there. And I can capture images. as well. And if I go to the side of the mouth, if I slide it down between the cheek and so this is proving interesting trying to do it on a screen, but um, uh, so what I've done is I've actually taken some images beforehand, which has got the actual a lot of the images that you can capture on here. With the different teeth images, and there's a gallery. And then if you see something that's a concern, Dr. Richard can just talk you through exactly how you can connect that through to a teledentist.
Yeah, well, first of all, the markups I like a lot. They're being able to measure. You've got a ruler. Very easy to learn how to do this, and you can measure what it is that you have of concern. If there's a lesion there, you can also have the ability to put a circle, and whether small, large, different size circle, into an area of concern. You can also type a note, and then store that, and then transmit it through email that's secure. It's really a tremendous, ability to mark up what it is that you're wanting to do if you're trying to get it to another provider. Say, hey, this is what I'm looking at, and the clarity is fantastic.
Mm.
And then I'll let you just kind of talk through linking it up with the teledentist.
Absolutely.
If someone has this, and whether it's another care provider or they have it, in their home, or ED or that sort of thing, and they want to get an on-time, real dental consult through the teledentist, then they can go through the software and just connect directly to them.
Yes, absolutely. So basically, once you've marked it up and you've put on there exactly what you want to do, whether it's, measuring a lesion or putting a circle around a spot that you might be interested in or concerned about, you can just click on a link and it'll actually email it to your dentist. It's not coming up on the screen at the moment. It's a little, oh, there we go. So sorry, Dr. Richard, you're still there. So basically, you can share it with the teledentist. When you're finished, it is a disposable blade, so please put it in the recycle bin, and the device just simply detaches as well. It's very simple to use. The idea is that you're capturing an image, and then you can connect that directly through to one of the teledentists, virtual dentists. And it's, just a really simple, easy way to have that consult with a dentist when you are based at home, or you might be remotely located, or wherever you may be. So, yeah.
Now,
Look.
to add that you can either do this obviously with your dentist, or if you don't have a dentist and need a consult with a teledentist, or if it's after hours or on the weekend and they're not reachable, and it's a little bit more urgent, you think, then you can go through the teledentist, and then they can do an initial assessment, and then assist with getting a referral beyond there. So it's not really a competitive thing as much as it is a service in doing an initial triage and then getting them in the right direction for follow-on care.
That's right. So even if you have, if you want your patients to connect to your dental clinic, it's a way of actually having that connection through with them. So they could actually email you an encrypted image from our app, and it would be a great way for you to connect with your patients whilst they are at home, particularly during this pandemic. So, basically that is it. We're just going to have a look and see if anyone has any questions for us, and if I'm just saying.
And if need be, I can answer them afterwards, because right now on yours, you'd have to read it.
Yes.
I'm looking at a screen within a screen.
Yes, no, that's okay. I'm just looking at them. So, Dr. Richard, so the question is about TelScope and it just asks if it works across many different platforms. So it works on any Android and also iPhone devices, and the app is available from both the Android and the iOS stores. So it is compatible. Just not sure. I can't actually see all of the questions coming through. It's fantastic though to see, Dr. Richard, I'll just let you know, we've got people from Japan, people from Canada, Arizona. We got Mark from the American Teledentistry Association. Hi, Mark. We have, Howard from the Teledentists. He's from New York. So, hi, Howard.
Howard.
Yeah, we've got a few from Arizona actually. I wonder if that's Western Australia. I think we had someone from Western Australia there. Um, yeah, no, it's fantastic that everyone joined us today. We are going to try and make Telehealth Tuesday a regular monthly event and invite brilliant people like Dr. Richard here to join us every month to build on, and help everyone in the telehealth side. So if there are ideas for us, that you're interested in hearing about, please reach out to us. If you have questions for Dr. Richard, we're happy to answer them after this. So just shoot us an email or comment below and we will get Dr. Richard to answer. And we also have a contest running. So if you're commenting and liking and sharing, we you'll go in the draw to win a TelScope system as well. So we hope that everyone's found this beneficial today, and we're very grateful to have you, Dr. Richard, join us for the very first Telehealth Tuesday event.
I had a good time. I really enjoyed it.
Yeah. All right. Well, thank you, and thank you for joining in. And yeah, thank you.